Good afternoon. My name is Dave Kerner. I'm located here at the Emergency Operations Center for Palm Beach County. I'm serving as County Mayor. I'm joined here by my colleagues from the Board of County Commissioners, including Commissioner Greg Weiss, Vice Mayor Robert Weinroth, Commissioner Maria Sachs. I'm also joined, as usual, by the Incident Commander, Ms. Virginia Baker, who's our County Administrator, and of course Dr. Alonzo, the Director of the Palm Beach County Division of the Department of Health, which is the lead response agency, as we're all well aware. Happy New Year. Today is December 31st, 2020. I've had the honor over the last 290 days of our operational response to COVID-19 to speak on behalf of the board directly to the members of our community, and I share the commitment of the members of the Board of County Commissioners to continue to deliver news and information and data directly to our constituents here in Palm Beach County, which is why we're assembled here today. It's a unique time period, as we're aware. We are transitioning to a new year. We're all excited to do that and to put 2020 behind us. But it's also coming at a time where the chapter is changing in our operational response to COVID-19, which is that emphasis and focus on the vaccination process. And I know that there's a lot of questions in the community and there's a lot of anxiety about how this process will play out, how our constituents will be made available to get that vaccination if they so choose, and what that timeline might look like, which is a dynamic process. I also wanted to have this press conference today to also manage some expectations in this process as we continue to work directly with the Office of the Governor, Governor Ron DeSantis, and our federal partners, along with our county partners in the Department of Health and the Healthcare District. I think it's important to, first of all, understand where we've been over the last 290 days in this county. Obviously, there's been a very broad diversity of responses by local governments throughout the United States with varying degrees of success. I can safely say that here in Palm Beach County, we have been able to maintain a very consistent, very safe way of life in this county, balancing the need for public health while at the same time balancing the need to inject new life and preserve what we have of our economic status here in Palm Beach County and our economy in general. And in doing so, the residents of this county have stepped up to the plate, and we're very thankful of that, because over the course of this operational response, the members of this county and the residents of this county have worked hand in hand with their local government leaders, federal, state leaders as well. And what that has allowed us to do as a county, which is a very important point not to forget, is it allowed us to get best of both worlds as we had to make difficult decisions with regards to regulations imposed on businesses and also regulations imposed on the personal freedoms of our constituents. We're delighted that our county continues to still wear the mask at high rates. We know that's participated and contributed to the very consistent, relatively low positivity rate that we've had in this county throughout the pandemic response when you look at it in relation to our counties of the same size in the state of Florida. You'll recall that there were 3 counties that the governor sort of carved out as it pertained to the COVID-19 response plan when the task force met and put those rules and phases in place. And if we look at how this county, in relation to Broward and Miami-Dade, has fared, we have a lot to be proud of. We were the first to enter phase 1, the first large county to enter phase 1. What that means is this county was able to capture the preservation of our economy more quickly and better than other large counties, both in the state and throughout the United States. We were also the first large county in Florida to move into phase 2, again, further bolstering the economic response and viability of Palm Beach County. We were the first large county out of the 3 to move our children into real-time in-person learning if the parents and children chose to do that. That gave the ability for parents to make the decisions that are important to their family and learn in person if they felt comfortable to do so. And we know that a large portion of our student population took advantage of that ability to go back to school earlier than other counties in the state of Florida. And we've done this while maintaining access to health care in this county. There was never a time where that was in jeopardy. Certainly throughout the course of this pandemic, there were highs and lows in terms of capacity in our ICU and our hospital system in general, but there was never a time period where if somebody in this county needed to be in a hospital, whether it was COVID-19 related or not, that they had that ability to do so. And that's very important when we talk about governmental response and what our obligations are as a government. We now start to focus on what's the next chapter, and is this next chapter the final chapter? And for all intents and purposes, as a layperson, I'm not a doctor, but from what I understand, this transition into the vaccination chapter very much could be that final phase, at least from an operational government standpoint, and how we can assist our constituents moving forward. I'm also aware that there's an immense amount of anxiety and confusion about the vaccination response. And I want to start by saying that you've seen this county and other counties in the state and throughout this nation ramp up very new and innovative procedures to get people tested en masse. That was a Herculean effort from a logistics standpoint, and we were able to execute that in this county. But I promise you, when I say that the efforts, the logistics, the complexities of delivering potentially 1.5 million vaccinations to this county, and you need to do that twice, and then you apply that to 67 counties in the state of Florida and 50 states in our United States, there's going to be supply chain issues, and there's going to be delays in how that is rolled out. And we know one thing for sure: the federal government needs to do a better job in rolling out the vaccines to local governments and states. They recognize that, we appreciate that, and it's probably not unexpected when we think about the scale of this operation. So my goal here today is to give you an update on what we should expect moving forward, and understand that it's subject to change. There's an important point in that the county government that represents you, the elected leaders here today, we are operational partners with the Department of Health, which is a state agency. However, the Department of Health is the lead agency, and we don't have authority to change the supply chain, how they deliver items to us, and what their policy decisions are. We are an operational partner, and fortunately I can tell you that on every chapter and every occasion we have worked so well together, and that has brought great value to this county. As our working relationship with the governor's office as well has brought great value and clarity, and bringing light to the needs of this county as well. So let me talk about why Governor DeSantis was here yesterday. You're all aware that he was here in Palm Beach County. I assume that you're aware of that. He was in Kings Point in Commissioner Sachs' district. Commissioner Sachs and I had the opportunity to meet with Governor DeSantis. And it provided an opportunity for us to display and remind Governor DeSantis that in Palm Beach County, we have some very, very unique needs in terms of our population, and the vulnerable population in particular. Over 25% of our 1.5 million residents are over the age of 65. And so yesterday we had an incredible opportunity, even if it was from a scale of how many people were vaccinated, there were 300 people vaccinated yesterday. But it represented an emphasis and a focus, at least from the governor's perspective, and recognition of the unique needs that we have in this county. And in our discussions with the governor, he has reiterated his commitment, as he has, to making sure this county has what it needs moving forward. So let's talk about where we're at with the vaccine. Well, first of all, understand that there are counties in the state of Florida that have not received any vaccines as of yet. We are one of 8 counties that received the first allotment. It should be no surprise because of the large population and vulnerable population that we have. But the truth is, Palm Beach County, as we sit here today, is ahead of the curve in terms of vaccination operations. We have already offered and inoculated the firefighters and paramedics of this county. Any firefighter or paramedic that wanted access to the vaccine was able to get it. We also started the process of vaccinating, in conjunction with our hospital and healthcare systems, members of the healthcare industry and the professionals that work within it that we're very thankful for their service. That process has already started as well. The process of inoculating, in conjunction with the governor's policy decision, which I agree with. I don't want to speak on behalf of the entire board, but I can tell you, and I said yesterday, that the governor's policy decision to put emphasis on inoculating and focusing on vulnerable populations over 65 is one that I support, and we've already begun to execute on that mission. But let me manage expectations for a moment. The process of receiving the vaccines from the federal government to the state, to the counties, and the distribution plan that goes with it is one that we don't have control over. And certainly everybody's looking to get these vaccines throughout the United States, and it's going to take time. If you're not 65 or older, I can tell you that you're not going to get a vaccination in the immediate future. We have a Herculean effort in front of us to make sure that we offer and vaccinate any person over 65 that wants it in this county, and that's going to be our main focus moving forward, and that's consistent with the governor's plan. But I have to tell you that to have the governor in our county recognizing that need and reiterating that need is an important thing that our constituents should understand, that both the county and state governments are in line in making sure that we get the resources that we need in this county. I would also like to reassure the community that we are prepared to support and collaborate with the Department of Health, the lead agency, moving forward. I know that I've received a lot of inquiries and a lot of questions from people in my district and in the county at large about I called the phone number and I wasn't able to make an appointment. There are going to be times throughout this process where the capacity that we have does not fill the need of this county, and that's going to be an ongoing issue, not just here, but throughout the entire United States. And so what I ask for on behalf of the Board of County Commissioners is your continued patience as this process rolls out. There will be times where you're not going to be able to make an appointment, that the telephone lines are busy, but as this operational response ramps up and access to the vaccine increases and our ability to execute on this comes to fruition, that problem will go away. And I promise you that in the near future, if you're over the age of 65, there will be a time in the near future where you will have access to the vaccine. And then we will start to transition later on in this process, and I'm not going to give you a date when the general public is going to have access to this vaccine. That would be unfair because nobody knows. It is a day-by-day process in working with the state and federal government to determine what our allotments and allocations are in any particular jurisdiction. But at some point, we will transition from 65 plus to the general public. But that's not going to happen today, and it's not going to happen next week, and it's not going to probably happen in January. We can look to February and March, but a lot's going to happen between now and then. But what I can promise you, and what Ms. Baker and Dr. Alonso, and certainly members of the Board of County Commissioners will reiterate today, probably in more detail than I will be able to, is that we are operationally ready. We have already started to execute on this mission, but we are operationally ready as a county to assist the Department of Health and the state of Florida to execute on this very important mission. We have the resources, we have the training, we have the capacity, we have the professional staff to be a force multiplier for this process. And we'll hear more about the plans that this county has put together because our professional staff, our emergency managers in this building, these professionals have been working on this plan for some time. And it's a plan that is designed to accommodate the changing needs of this county, but also the changing dynamics of a very complicated process in distributing hundreds of millions of vaccines to local governments throughout this nation. With that, I'll have some more comments towards the end of this press conference. I want to give an opportunity for Dr. Alina Alonso from the Department of Health to speak, and also our incident commander. And then we'll hear from also our elected county commissioners to deliver some final messages as we transition to 2020. What I can promise you is that it has been a huge honor to be able to stand at this podium and deliver information directly to the members and residents of this county. It's one that we remain committed to. We believe that making sure that you have all of the data and all the information and that it's directly received from your elected leaders is of great value to you as an individual and family sort of contemplate what the future holds for you in Palm Beach County. And also in doing and executing on my duties as county mayor, I'm proud to report that this is the last time you'll have to see me for the rest of the year. But we remain very much committed to speaking directly to you, being candid, being honest, but also ensuring that as a responding government that we have the resources and professional needs met for this county, and that we will continue not to let you down in that regard and do everything that we can to make sure that we efficiently, effectively, and safely protect the public health and the people of Palm Beach County. So at this time, let me turn it over to Dr. Alonso, then we'll hear from Ms. Baker, and then from our elected officials, and I'll have some closing comments, and then we'll go to questions. Thank you. Dr. Alonso?
Thank you very much, Mayor. Thank you, Commissioners, for being here, backing me up. It always feels better when they're standing behind me. I want to start off with talking a little bit about what I've always updated you on, which is the numbers. So what we have seen in the last several days is that our numbers have stayed below the 600 numbers. On Tuesday, our last report, we had 483 new cases in Palm Beach County. Our total number that we have right now for the county is 81,899 new cases as of Wednesday. That's 509 new cases for Wednesday. The new cases for Tuesday on the 29th was 483. So you're seeing that we're staying below that 700 that I was afraid we were going to be up at in the new the days. Now, true that the holidays have been here, and we've had Christmas, and now we're going to have New Year. So a lot of people have not been getting tested. Some of the sites have been down. So like the governor said yesterday, we're going to see these low numbers now over the holiday, and they'll rev up as we go forward next week. In terms of our positivity, we saw a very alarming total positivity of 13.84 on Monday, and then 13.88%. That's for the total. That has steadily been going up. The other thing that we've seen go up and down was very high is the daily positivity rate. On Sunday, it went up to 10.38, way above the 10%. But as an average, it has stayed around 7%. Last Tuesday, it was at 6.95%. So it's staying around that 7%. Do I want it below that? Yes. I want it back to 2% where it was when we went down back in October. Okay? But we are at least not climbing really high on those numbers. That tells me that people are doing some of the right things, maintaining your masks. You're all distancing today pretty well. A couple of you are a little too close together for my lecture today. But people are paying attention. They know how serious this is. They're watching the rest of the nation with hospital surges and hospitals not having sufficient staff, not having beds for patients who need to come to the hospital. We have been able to avoid that in Florida. So we're doing things better than other folks, at least, and I think it's because people are listening, and you, the media, are helping us to get that message out. So please keep doing what you're doing in helping us with that. In terms of our vaccines, we have an update. Mayor Kerner, we actually vaccinated 407 senior citizens yesterday at Kings Point. One of the first things I did was make sure that we got extra help. We know that we can't do this alone. The main objective for the Department of Health is to get that vaccine out to our partners, who then will be doing vaccinating. We need all of our partners to help us in this. And in Palm Beach County, we're very fortunate that we have a great Department of Emergency Management here in Palm Beach County, and a commission that supports that, with a mayor and commissioners who understand the importance. They've had me at every single commission meeting, and I have tried to educate them, and they've educated me on the politics. So we have a very good working relationship, and I cannot say enough for our commander, Ms. Virginia Baker, who has always been doing what is best for the community and helping the Department of Health all along. So we were the last to get the vaccine. This happened right before the holidays. We went off for the Christmas holidays, and now we're going to be in the New Year's holidays. As a matter of fact, I'm off today, so I'm wearing my jeans. What can I tell you? So we're going to continue working. We have made alternative plans to our telephone system that absolutely died on us. It didn't just die here, it died across the state. The system is not made to get thousands and thousands of calls per minute. Many of the other counties that occurred also, even in some of the big hospital systems like across in Broward, the same thing happened. So it's just a matter of too many people calling in at the same time. We've put in another system in place in addition to the phone calls. We've got a data system that we're working on that will allow us to then implement into the Florida system so we can keep track of the appointments and the people calling in. And we're also using our email to be able to then call these people back and make appointments. Our vaccination for the over 65 is continuing. We're calling people back, we're bringing them in, and remember that we have to give a second appointment for them to come back 4 weeks later. So that means that every time we give a vaccine, that date 4 weeks from now is going to be tied up with that same volume of people. Okay? So this is a very tricky and more complicated than usual appointment system, and not too many systems out there can actually handle this. The other piece that complicates this is the fact that it all has to be entered into the Florida shots. One of the things that we were expecting to do was to do the fire rescue, the EMTs, the paramedics, and then we were going to do the healthcare workers. We didn't know that we were going to get the 65 and over at the same time. So all those things coming together. Now, what's my message? What do I want you to take away from here? Please do not panic. I don't want to see any senior citizen in this county sitting in a chair or with a walker in line in the heat or sitting for hours waiting for an appointment. That is not necessary. Please do not do that. There will be plenty of appointments. We're going to be going out with mobile units. We're going to create field centers where people can drive up or walk up and be tested. We're going to have multiple sites out in the community. We're going to have multiple partners in the community. The healthcare district is going to help out. Our private providers are going to help out. Doctors will have vaccine in the near future to be able to give out to their patients. So all this will be happening. There's no need for somebody to take a chance on getting hurt or be sitting for hours waiting for an appointment. We will call you back. We have the names, we have the numbers, and we will call you. So just be patient, and what I keep repeating is there's over 200,000 people that are going to get this vaccine. Everybody cannot be first. All right? So be patient. We will get to you. We will make sure that we have the vaccine for you. And one of the first things I did was call and say we need help with these large facilities. So they have put into place what we call incident management teams that will be going and staying at Kings Point and Century Village, not only here in Palm Beach County, but also in Broward. These teams will come in and help. So you have state resources being put into Palm Beach County to help us do this. They will be doing 500 senior citizens per day. We will also be doing healthcare workers and senior citizens, and our partners are going to be concentrating on healthcare workers and senior citizens. The vaccine for the healthcare workers is so that they can get vaccinated, so then they can give out the vaccine. Okay? The vaccine for the general population will come much later. But everybody, please, let's start the new year with less anxiety. Let's throw that old anxiety out with 2020, let it go, and start the year knowing that there's plenty of vaccine. We will get to you. You will get your vaccine, and we will all be working in this together with all our community partners, and the press is always welcome to help us to get these messages out. I know you get lots of questions, and hopefully we're giving you the information so you can answer also some of these questions for us. Okay? Thank you.
Thank you, Dr. Alonso. And let me just reiterate my appreciation and support for the Department of Health. You guys have done Herculean and incredible work in this process from day one. You in particular and your staff as well. And the messages that you've delivered today are very important in terms of managing expectations. But I want you to know, and I want the people of this county, they should be proud of the work that the State Department of Health has done. There's been no response in this nation that's been executed perfectly. But I can tell you the work product and the commitment to achieving the unified goal that we have in this county, which is protecting the public health moving forward, could not have and will not be completed without the awesome and incredible help of Dr. Alonso and the Department of Health in general. So thank you. Ms. Virginia Baker, our Incident Commander and County Administrator, please.
Thank you, Mayor. Good afternoon, and thank you for being here. I don't know about you, but I'm happy to say goodbye, and I do mean goodbye to 2020, and hello 2021, because I believe working together, we're going to make for a better 2021. This has been a challenging year, and as the mayor stated, we are in our 290th day emergency operations. We have addressed a pandemic for approximately 1.5 million people, and we have kept county and city governments continuing to operate and meet the needs of our citizens. We have unfortunately imposed, and you have adhered to unwanted requirements, but it was necessary for us to keep our community safe. And not only have we kept our community safe, we have moved forward. Our businesses are back open. They're starting to move forward. We're working together as partners to ensure that in order to keep them open, that we all must adhere to ensuring that we're all safe. That includes wearing our masks. That includes continuing to distance, as well as washing our hands. We want to make sure that we are also avoiding the 3 C's, and that is close spaces, crowded spaces, and also confined and enclosed space. If you must go out tonight, I'm going to strongly, first of all, encourage you to stay at home and celebrate with the folks within your household. But if you must go out, please keep those things in mind. Wear your mask, do your distancing. Make sure you're avoiding the 3 C's as I previously outlined. Remember, it is safer at home. We want you to be able to celebrate not only 2021, but 2022. This virus is not just singling out our elderly, but they are also having a significant impact on our younger people. And I'm talking 30-year-olds. And I personally have heard of one that I was shot in good health. So you may be in good health, but you need to be very concerned and responsible tonight if you go out. And I am particularly speaking to our young people, our millennials, our children. We want to make sure you come back and that you're safe. If this particular virus does not kill you, it will have long-term effects on your body. And so we need to make sure that we talk to our loved ones. Parents, let's talk to our kids. If they've got to go out, they need to make sure that they're doing it in a safe manner. So again, as your incident commander, please keep your distance, wear your mask, and avoid the 3 C's. Thank you, Mayor.
Thank you, Administrator Baker. It's now my pleasure and honor to welcome the County Vice Mayor, Robert Weinroth, for comments. Sir?
Thank you, Mayor. Again, this has been quite a year. Last year, at New Year's Eve, we all thought that 2020 was going to be a great year of promise, and obviously this has been a year of challenge. But we've met those challenges. And Mayor, thank you so much for your leadership. This has been a year that has certainly taxed our resources, but our incident commander, our county administrator, has really done double duty and kept us moving forward and kept many of our residents from getting sick. And this response you should be proud of. And we are turning the corner, and I am, like the mayor and like everybody else up here, looking forward to 21, looking forward to the idea of not having to wear these anymore, looking forward to getting the vaccine and moving forward. So we have an opportunity ahead of us. We have a brand new year. Let's look back on what's happened. Let's look at what we were able to accomplish. This vaccine is a godsend. This vaccine really is a miracle. As I said once before, it took over 20 years to get a vaccine for polio. We got this one in less than a year. It's miraculous. So everybody who wants the vaccine, again, understand from our perspective, 400,000 people were put in the front of the line that we weren't expecting. And the healthcare district and the Florida Department of Health is working to accommodate that new priority that the governor set. And we as a county are working to support the Florida Department of Health. We will be there to give them the resources they need as they need them. And we are looking forward to the opportunity to make sure that everybody who wants a vaccine will be able to get that vaccine in the coming months. So without further ado, I'm going to invite up Commissioner Weiss to say a few words.
Thank you, Vice Mayor, and good afternoon. Greg Weiss, County Commissioner for District 2. I want to reiterate a lot of what's already been said, but I don't want to spend a lot of time doing it. But first, to Dr. Alonso and your folks over at the Health Department, thank you for being such great partners with us throughout this past year. I also want to let you know that your Board of County Commissioners is committed to keeping the people in Palm Beach County safe, and we will all work together with the state and with our health department to make sure they get the resources that they need to be able to deliver this vaccine as quickly and as efficiently as they can. But people are going to have to be patient. We can't do everybody all at the same time. There's going to be a first person, and unfortunately there's going to be a last person, but we will get everybody who wants to get vaccinated that opportunity. So be patient. They will be rolling out, and we will be supporting the efforts of our state and our health department to make sure everybody in Palm Beach County is able to get this vaccination. And then lastly, I just want to wish our residents a very happy, a very healthy, and a very safe 2020. It's going to be a much better year. Thank you. And I'd like to bring up Commissioner Sachs for her comments.
Thank you so much. Sure feels good to take that mask off, and I look forward to one day not having to put it on in the morning. Good afternoon, my fellow colleagues, Dr. Alonso and Ms. Baker. Yesterday, history was made when, with 24 hours notice, one of the first senior communities in our county prepared for a visit by the governor and prepared for 300 inoculations to occur. 24 hours. This one particular community, senior community, is one of the first in the 70s to be built in Palm Beach County. It contains over 12,000 residents in 1 square mile. One of the reasons it was chosen is because it was one area that had the highest incidence of the virus at the beginning of this year. It was a perfect location to begin the prototype of a point of destination, so that under the leadership of Dr. Alonso from the Department of Health, we were able to have this public-private partnership with the community association to bring together 300 residents out of 12,000 in 24 hours notice to register, get inoculated, and be recorded of having taken the vaccination. So I'm very proud of the people of my county. I'm very proud of the people of our senior communities, and this is just the beginning. Yesterday was just the beginning. Next week we're going to move on to Century Village, and here in Boca Raton, they're already beginning to get mobilized, and we're looking forward to be able to inoculate as many seniors in a safe and administratively correct way as we can. Somebody once told me there's a great prayer for patience. Said, Lord, give me patience and give it to me now. The best way to handle, and I have received a couple of comments from my constituents, The best way to handle impatience, frustration, and anger is the feeling of gratitude. My fellow Palm Beach County folks, just look around. We have some of the best weather in the country. We are so blessed to be living in Palm Beach County. We have hi-fi internet, we've got Zoom. Hopefully we have family and friends around us, and if we don't, we certainly have neighbors and hopefully a good dog that's ready for exercise. Publix has toilet paper again, so at this time of the year, we need to, as everyone behind me has said, just be patient. The vaccine is here. Everybody will have an opportunity to be protected by this vaccination. So before we close the book in a couple of hours on 2020, I'd like for us to remember those small businesses that have suffered so much this past year, many of whom have had to shutter, and hopefully, in my book, just for a while, before we get to a rejuvenation of our economy. I'd like for us to remember those who lost their jobs and are waiting every day for a payment either from the government or from whatever they can do to get food. And I'd like for us to remember those 21,000 people in Palm Beach who lost their lives to COVID. Yes, we're impatient, but let's not forget those who have lost their lives, and there isn't a family here that has not suffered because of it. We have gone through this. We've gone through it, some of us alone, but we are together now. We're together. We're looking forward to a new year, a new beginning. And God willing, it's going to be a happy new year, healthy, happy, and safe for everyone here in Palm Beach County. Thank you to our leadership, to my fellow colleagues, to Ms. Baker. Let's look forward to 2021. Thank you.
Thank you, Commissioner Sachs, Vice Mayor Weinroth, Commissioner Weiss, and the entire Board of County Commissioners, both for your leadership throughout this pandemic and for your comments here today and for joining me on the eve of a new year after what has been described through a lot of euphemisms for 2020 as challenging, unexpected, devastating, but it's also been combative. It's been a combative year politically, it's been a combative year policy-wise, it's been a combative year in the way elected officials speak to one another and the way they speak to the community, and it's been combative in many ways in how we treat each other. And one of the culture issues that I've attempted to foster in my time in leadership of this board has been to work regardless of partisan ideology, regardless of differing perspectives, to work most effectively on behalf of our shared vision, and that's protecting the people of Palm Beach County. And I think that there's a lot of value in doing that. It's been an honor to work with the appointed leaders. It's been an honor to work with Governor DeSantis. It's been an honor to work with members of Congress and our state members of the state legislature. But I hope that we've demonstrated to you that no matter what the issue is, if it affects the public health and safety of this county, we will work with everyone and anyone we need to do. And that will be a continuing theme, both in my leadership and the leadership of this board moving forward into 2021. And I hope that is a perspective that the people of this nation take as we decide how to move forward into 2021. We talk a lot about putting 2020 behind us. We have a lot of devastating things that have happened, but as Commissioner Sachs has pointed out, we have a lot to be proud of. Vice Mayor Weinroth and Commissioner Weiss talked about that. We have a lot to be proud of in this county, and we have a lot to look forward to in the future, and we're very fortunate for that. So I hope as we turn the page into 2021, you join me and I join you in renewing our commitment to the American dream, which is still alive and well in this country, while not forgetting what we've lost in 2020. We will continue to govern in the best interest of the members of this county, regardless of who we have to work with. And I know that when I called this press conference today that the members of this community wanted answers and they wanted a resolution to the vaccine difficulties that lay before us and in the future. Unfortunately, I can't give you that resolution today. But if you're 65 and older, I want to speak directly to you for a moment We have heard your fears, we've heard your frustration, we've heard your concerns. And I can promise you, as I have in the past, that we will respond accordingly to those concerns and anxieties, and that you should not have those fears, concerns, and anxieties. We have a very robust plan that we'll be talking about more as we move into 2021 about how we intend to execute on our responsibility to take care of our vulnerable population, but we will take care of you, and we will ensure that you have access to this vaccine as quickly as possible. And then, of course, to the public at large, thank you for your trust and confidence in your local leaders. It's been an honor to represent this county in 2020. We look forward collectively to continuing to lead on your behalf in 2021. I wish you a happy new year. Thank you for what you've done and will continue to do, and God bless you. Questions?
Yes, you talked about the efficiency. I'd like to talk about fairness for a minute of the over 65 population. What are you doing to make sure that people in minority communities, rural communities, and people who are poor, and for example cannot afford to live in a place like Kings Point, have a fair shot at a vaccine? And are you keeping statistics so that if we look next week, we will see that at least on a racial content, that we will see that the vaccine has been done in a fair across-the-board way, as opposed to a perception that maybe well-connected people that are first in line?
It's a very, very good question. The question is, how is this county government, in conjunction with our partners who actually make those decisions for us on a lot of occasions, how are we going to ensure that it's equitably distributed in our communities, and that regardless of your race, color, creed, origin, financial status, that we're doing it in an equitable way? I'm going to ask our county administrator to respond to some of the specifics that we've discussed privately about how we accomplish that. But let me be very clear with the public that there will be some inequities in how this is distributed. We cannot do everybody at the same time. The first inequity is that we're going to do seniors first. That's a policy decision that I support fully. So then we have to peel back the layer of how do we make sure that we distribute it within the 65 plus community equitably. Why is Kings Point being chosen and not community B or C or D? And I get that. That's a real issue, and access to health care has been an issue in this country for a long time, and how it's equitably distributed throughout our community. So we have a plan in place. We're very cognizant of both the perception and the real impact of inequities, and I'm going to ask our incident commander, Ms. Baker, to speak further on how we intend to allay your fears and concerns, which are very real.
That was an excellent question. We have definitely been dealing with that particular issue. We are mapping our community based upon census. We're looking at our communities that are 65 years and older. That's what the census data provided for us. And you're absolutely correct. Most black and brown people do not live in the 55-year-old gated communities. And so it is going to be incumbent upon us to make sure we identify, based on census data, those particular communities, and ensure that as we move mobile units through, we're going to have a number of strategies that we will employ. And so for those gated communities that we deal with, they have their rooms that we can utilize. But for those other communities, we're going to need to take mobile units there and do pop-ups so that we can make sure that we're addressing the needs of our black and brown communities and others. Because we've got straight subdivisions throughout this county. And a lot of our straight subdivisions are also Caucasians that live in there. We are going to protect every resident in this county. And our plan will ensure that we have accounted for those residents, regardless of where they live. And so that is one of my priorities in ensuring that we roll this out. That is why we're not just rolling it out because we're talking and we've got vaccine. We're planning, we're making sure that we are incorporating all of our communities. But as my bosses have said, we can't roll out everybody all at the same time. There are going to be some communities a little later, but we're going to ensure that we've integrated our processes so we can roll equitably across the board.
How soon in minority communities will we see these mobile?
You're going to see those particular minority communities involved with the first rollout with all the others. The governor selected Kings Point. We did not. We supported it because he's our governor and he gave an edict. We made sure it happened, working with our health department. Under my control, we will continue to work with the health department under their directions, under the guise of the governor and the health department, and ensure that we've got an integrated system that moves forward in Palm Beach County.
Can we expect to see it next week in minority community?
We are, whenever you see it roll out for the others, you will see it roll out in the minority community. Yes, sir. And thank you for your question.
I wanted to ask, what made you guys make the decision to start vaccinating the population 65 and up before finishing up with long-term care residents and with people who are in the medical field? Kind of what made y'all want to open the doors to that age group?
And I'm going to repeat the question in just a moment, but let me just put a button on that issue. As we have always committed, you have my personal commitment and the members of this board that we will continue to provide the data on an ongoing, real-time basis of who we're selecting in terms of communities to receive the vaccine first, and how we arrived at the decision and what that data is. But let me tell you, the politics of vaccination are very real, and we've seen examples of elected officials jumping the line. That was something Governor DeSantis talked about. That's unacceptable. That's not going to happen in this county, and we're not going to allow people of power or people of influence to cut the line or do things that are not honest and fair to the everyday American like myself. I will not be getting a vaccine before anybody else. I'll make sure that I'm the last one to do it. I'm 37 years old, and there's no reason for me as an elected official to get vaccinated before anyone else, despite the fact that we've had U.S. senators do that and members of Congress. That doesn't reflect our collective community spirit and moral values. With regards to your question, ma'am, the question was essentially, how did we determine, or how did we decide to move forward with 65 plus vaccinations while we're still doing long-term care facilities? Well, I think you're going to see sort of the confluence of different sectors being inoculated at the same time. We have abilities to do, because of our partnerships with hospitals, because of our partnerships, Department of Health and healthcare districts, we can actually touch a few populations at a time. But really the long-term care facility, I think, is an effort that's directed by the governor's office as well. I think they have special teams that go in there. But you will see an overlap of populations being inoculated, and that's one of the beauties of our system and the resources that we have, is that we have the ability to touch a lot of communities at the same time and different populations.
What specifically are you doing for the people who can't get through over the phone, or maybe this is a question for the health department, but what specifically is being done so that the people who can't get through over the phone are being recorded, their information is being gathered, so that if they're unable to get a vaccine right now over the phone, they can be given as soon as possible?
The question is, what are we doing about the people that can't get through on the phone? The other night, for example, we had staff that stayed until after midnight, till every single person that was on hold was answered. I don't think those are things that get reported in the media. So I'm reporting it now. We're doing that. We also have an email system that we set up for people to email, and everyone that leaves a message with the emails will be given a date. We will call them back. So that's another system that we have, is that we will call people back and then set up their appointments. So there's multiple ways to have it done. We've been vaccinating over 500 people per day already. So that has begun. Like I said, we were the last ones to receive the vaccine, so we're a little bit behind the other 7 counties that got it before us. But that's what's happening.
Can
Thank
I
you.
ask you, while you're still there, a
Sure.
follow-up to that? The email is chd50feedback@myflorida.gov.
Correct.
That's not
That's
exactly.
just so I can repeat it because they don't hear your question.
Sure, well,
The email is chd50feedback@flhealth.gov.
and the question is, that is not exactly the most user-friendly email for somebody from a generation that's not exactly tech savvy. Can you do better than that? Also, it doesn't say anything. There's no thing about leaving your name. It's just a blank slate. Do you need to do better than chd50feedback@myflorida?
It's been very effective, so I would say we've gotten quite a few of those emails, and they're leaving their name, their telephone number, their date of birth, and their address. But we certainly have their emails when they send us an email, so we're able to email them back if we don't have the rest of the information. So we're able to use that. We have set up a data system that will be able to integrate with the Florida Department of Health Florida Shots that will automatically allow us to set up appointments. And we're working with other databases that may be helpful. We brought back an old database that we had from H1N1 that we used back then. So we're using multiple ways of doing it, but you're absolutely right. For those people that don't have email, right now they like to talk on the phone. I've taken personal calls. I've answered phones, so we're all working on that and getting through and calling back everybody that has called us to give
Because of
appointments.
what we can describe as an unusual, fair to say, email address, was this the kind of thing that might be incumbent upon people to step in and help their parents if they're not tech savvy?
Oh, of course. Yes. I have my sons help me all the time. Thank you.
Commissioner Weinroth, may I ask you one question? Because you addressed the elephant in the room about 400,000 people that was kind of pushed to the front of the line. Do you, in terms of the seniors, do you think the governor made the right decision, or is this just something because the decision is made, we have to work with? For example, could he have made it 75 and older? Could there have been people 65 and older but with pre-existing conditions?
The question that was asked was, do I agree with the opinion of the governor placing the seniors ahead of some of the other people as the CDC had set them up? And I really don't think it's important what my opinion is. I'm ambivalent. I would think that people who are touching people more readily, healthcare providers, dentists, may have been the ones that if I was personally doing it, I would have put in front of the line. But that's not my decision to make. Governor's made the decision. We will implement that decision accordingly. And I think that it can be done effectively. I think that he has made a decision that is, again, we have in our county 400,000 plus seniors, and we want to protect them. Those are the ones who are dying. Those are the ones who are getting the complications from the disease. People like me, even though I am over 65, probably would get the disease and survive it. The seniors that have not been able to survive it, I can understand why the governor has made that decision, and I'm not going to second guess him.
Mayor Kerner, I'm gonna ask the cheesy, how does it feel, for all of y'all that hopefully this is about to be in the rearview mirror as far as, you know, we've gone through this awful pandemic and now we do have hope for 2021.
The question is, how do I feel, how do my colleagues feel about the concept that this is maybe going to be in the rearview mirror in the near future, and how do I feel about that? With all due respect, I reject the premise. I don't think that we're at the finish line. I think that we're entering the final chapter, and a lot of bad things can happen in the final chapter, and we've worked so hard to get to where we're at and protect the public health and our economy. And if those that are watching this and those that are in our community think that we're right around the corner, we're not. And that's one of the reasons I called this press conference. So I would say to the people of this county, we're not at the finish line, but we have a plan to get there. We need your help to maintain the public health. That means wear your mask, be cognizant. Even after you get your vaccine, wear your mask, be cognizant of being in crowded spaces. Find ways to continue the way of life we've been doing for the last 290 days. We will continue to execute on our responsibilities. We will continue to communicate directly with you, but we are not at the finish line. And we have a lot of game left to play, and I want to make sure that we don't fumble on the 1 yard line.
Has anybody up there received the vaccine, any of you?
I qualify for many reasons, but I made sure that all my frontline staff got the vaccine before me. They wanted me to go first to give the example, but I decided I'd go after everybody else. And so I'm very happy to have gotten it. It hurt for one day at the site, but other than that, it was, I didn't even feel it when I got it. So I'm very proud to have gotten it. I think it's a historic vaccine in the way that it was made, and it's revolutionary for the way vaccines will continue to be made. But it wasn't a miracle, guys. It was science that made this vaccine possible, and years of study, over 10 years of studying on the SARS virus and the coronavirus to make this vaccine. So scientists will say that it wasn't a miracle, that it was a lot of work, and I'm very proud to have gotten the vaccine. Thanks.
One other category was 65 and over. How much, do you have to be a native of Palm Beach County? Do you have to own property? Could somebody who's here for 6 weeks or 5 weeks, if they happen to have made an appointment, get it? And what some might think, get it ahead of somebody who's lived here 2, 5,
Yeah.
50 years?
It's a good question because the issues come up, and the question is essentially, do you have to be a landowner or a resident or a homesteader of this county to be able to be inoculated? Because we do have a very transient population in terms of coming down from the north. That question was asked, I think, to the governor. Correct me if I'm wrong. I think the governor reiterated that if you're in this county and you meet the qualifications, regardless of the reason you're in this county, you are eligible to get vaccinated. And that's consistent with our larger goal, which is really to get as many people vaccinated that are in our community, whether they live here permanently or not. That's an overarching policy goal, and so it makes a lot of sense to me. Anything else? Well, Palm Beach County 2021 is upon us. I wish you a very safe and healthy New Year's Eve celebration. I'll note that because of the good work that our county has done and the people of this county, unlike Broward or Miami-Dade, we do not have a curfew. But as the county administrator reiterated, please, of course, conduct yourself in accordance with your values and the public health. We wish you a Happy New Year, and we'll be continue to working on your behalf until we cross the finish line. Happy New Year, everybody.